Good afternoon. This is Dr. Bacon, Director of Advanced Spine Health and Wellness. Our tidbit of the day. Everyone is concerned about a herniated disc, certainly when they experience one. I would think that everyone would probably not want to have that. Most of the people that know of it is quite a debilitating situation and very painful. The issue is that why wait until one happens? Understand how it happens and then don't do that. Okay, when we take a look at a normal spine in the human existence, we're supposed to see these forward curves in the neck, in the lower back. The lumbar spine is where a lot of disc herniations take place, and the neck is also a very prevalent place. The disc is 82% water, so that the hydronics are such that the water content or fluid content is open, pushed to the open wedge side away from the spinal cord and neural structures, as long as is forward curve in the neck and in the lower back. The spine is a system, a three-dimensional physiological and biomechanical entity, so it functions like physics, mathematics, and geometry, what I try to teach and get people to understand, so that in its neutral position it cannot go through a plane of action and go against the path of greatest resistance, gravity. It has to move around arcs of motion and either to the right and or to the left. The disc herniations in our society are always backward and to the left or backward and to the right. Only 8% of them can go straight back, and they're usually associated with falling injuries like that. So that in order to get a disc herniation, first of all, you've got to deviate from the ideal configuration far enough around that arc of motion so that the hydronics, the fluid pressure, if you will, goes backward and to the right, because around this section here on either side there is no ligamentous protection, so it's very easy for the discs to herniate backward and to the left and backward and to the right. So if you keep a normal forward curve in the lower back and make it strong like that, it will function very, very well. It gives you a lot of mechanical advantage. That's why it's designed like that. And it gives you the ability to absorb shock and push that fluid dynamics of the disc away from the neural structures. Very safe condition, incidentally. So what we want to do is, in order to end up with no herniated disc, you got to have an assessment and find out where you are as far as the status of your curves in the spine, especially neck and lumbar spine. See if they're balanced under gravity, both from the side view and from the back view. If they're not, get on a program to make that happen, because also we'll talk into our next tidbit about the tension that's created on the spinal cord and meninges. It interferes with cerebral spinal fluid to the brain, your cognitive functions. And so then right now we're talking about discs. So if you don't want to have a herniated disc, then find out where you are in this situation and get the curves back to ideal. It's not that hard to do, a little bit of work and time, but just about everybody can retrain the tissue and get that back into an ideal configuration. It is not done by traditional chiropractic alone, by manipulation or spinal adjustments. It has to be done by specific and strategic rehabilitation protocols that go in and deal with the core, and yes, I mean the absolute center, not the abdominal muscles, which are commonly thought of in our society as core. It is not core. Core means center. Look it up in the dictionaries. And so that means the spine and the paraspinal tissues immediately around the spine, which have to be rehabilitated back into those ideal configurations, side view and also back view, in order to remain and maintain health and restore balance and physiological function, mechanical stability and mobility in this spinal skeletal system. Tidbit of the day, Dr. Paul Bacon, Advanced Spine Health and Wellness. We suggest come on in, check it out, find out where you are, and get it fixed if it isn't right.